Mr. Mayor.
Thank you very much, Mr. President. I'd like to thank everybody, first off, for being here to talk about this horrific crisis that's not only facing the city of Revere, but facing Massachusetts and cities and towns across the country. Many of you may know that back on June 22nd, Governor Baker released a report of 65 actionable steps that were agreed upon by an 18-member opioid working group that was developed by the governor and lieutenant governor to combat the state's staggering opioid epidemic. These findings are extensive and spread across areas of prevention, treatment, intervention, support, and education. A lot of people have a real misunderstanding about the opioid crisis. There is a stigma that comes with the opioid crisis, and people that have suffered addiction. But I bet there's probably not many of us in this room that don't at least know somebody that has succumbed to addiction, maybe have family members who have fallen to addiction. And sadly, some here in the room have probably even lost people that they know and love. We have been dealing with this issue as a community now for quite some time. We have some people here from Revere Cares and the Winnisimmet Regional Opioid Collaborative, in which the city of Revere spearheads under the direction of Julia Newhall. Those communities include Winthrop, Revere, Saugus, and Chelsea, all again dealing with this terrible, terrible problem. Yes, anecdotally, you should know that just over the 4th of July weekend, we had 10 Narcan reversals here in the city of Revere. 10. That, but for the Narcan, we may have lost 10 people in one weekend. Town of Arlington had 4 such incidents, but only 1 reversal and 3 fatalities during that same time period. This is a problem that is far-reaching and seemingly out of control. We have taken great pride in our participation in the ROC, this Winnisimmet Regional Opioid Collaborative, but we've also taken it a step further, and we've created our own opioid task force here locally, because as much as we like to work in collaboration with other cities and towns, the problem is epidemic now. Last year, I believe we lost 13 people to overdose. We've already surpassed that number this year, and it's only July. So it is clearly a problem that needs to be handled and dealt with, and I appreciate the City Council's interest in working with us to help solve it. Tonight, along with you, the City Council, my office, the Healthy Community Initiatives Department, and Revere Cares Coalition, what we'd like to do is make a presentation to you about what's being done locally around prevention, intervention, treatment, and recovery, and what more can be done through our own local Revere Opioid Task Force. I will bring up Dimple Rana in just a couple of seconds, who is the manager of our Healthy Community Initiatives Department. But first, I'd like to bring up our Fire Chief, Gene Doherty, to talk about, from his perspective, on what's happening regarding this opiate crisis. Chief?
Councilors, good evening. As the mayor stated, there's a collaborative effort throughout the city on dealing with addiction and abuse of alcohol, tobacco, and opiates, whatever, we call it the ATOD task force that started, come out of Revere Cares, the alcohol, tobacco, and other drugs. I first met with Kitty Bowman from Mass General and Revere Cares back in 2004 when she started her Learn to Know program, and we talked a great deal about what we saw then relative to overdoses or the proliferation of addictions. And it proceeded to a point that in 2011 we hit representation on the Revere Cares and the ATOD, and with Captain Piccarello from my office was on a regular. We attended all the meetings and went forward with what we thought at that time that was recommended by the experts as to what were gateway drugs and things such as that. So you fast forward to 2011, and we were very fortunate to meet up with a friend of ours through high school, Jay Pick and myself, Gary Langis, who's a harm reduction specialist, and made us aware of this Narcan that was out there that they were actually issuing to parents at the time of people that were in addiction. And we had no idea what it was, and Gary had explained to us that, geez, you really should get to know how to use this, because the parents in the time of when somebody is overdosing, they don't have the wherewithal or the presence of mind a lot of the times to do anything but be in total distress. So he brought it to the stations, and we made a presentation to the firefighters and told them they might meet up with this. And we were able to hook up through that with the Department of Public Health on a trial basis and as a test basis. Revere and Quincy was to carry Narcan on all the fire apparatus. Quincy Police decided to take it with them. Revere Fire did it here. It was the first in the nation where first responders, not medics on the ambulance, first responders were applying Narcan. They wouldn't even let us have an EpiPen, EMTs at the time. But we went through this program, taught all the firefighters. The union was tremendous in it. They stepped back, knew it was a possibility, it was going to do very well for the citizens. They saw the results immediately. They were actually, truly saving lives. And as it went, other departments, it took a few years, but they started following. Again, going into the last couple of years, we've had both the drug czars come up and visit us, specifically because of the programs in Revere. And one very under-the-radar media, the last drug czar for President Obama, met down at the Parkway Station, the mayor, our firefighters, people from Revere Cares, and was praising us for the programs that we were doing, that we were ahead of the norm. Sad to say, but we were ahead. The new appointment from President Obama, Michael Botticelli, who was a local Massachusetts former Department of Public Health person, specifically invited myself and some Metro Fire chiefs down into D.C. We went down and spoke to his opiate specialist, this Dr. C.C. Spitnas, and told her the programs we were doing, and specifically the idea that here in Revere, we were attempting the Narcan just wasn't enough. We were kind of like putting the finger in the dike, and we had to do something more. And I more or less I stole something out of the Weymouth Fire Department. They set up a great website, and they were mailing out a packet of information to anybody that they went to their certain address and applied Narcan to that person. So I decided we could take that one more step further, and we would actually have firefighters go out and follow up at the homes for these people that had an overdose or in a reversal, and to offer specific help for the abuser, but in particular the families, because the families are left in this lurch. There's denial, there's not really knowing what's going on, and there's not knowing where to turn to. So specifically, this folder you all have up in front of you, it's missing one part to it. It's a large program from Learn to Cope. But this folder goes out with a couple of firefighters, one firefighter, a recovery coach that's affiliated with the drop-in center that Mass General Revere Care sponsors on Tuesday nights at North Suffolk, They might go out with the addiction specialist that is there, but we go to the homes and we offer this information. We've only since June 1st, we've made 9 visits to homes. It's a little difficult sometimes where the overdose is from another city, which is a lot. They come into Revere, they make their buy and get overdosed in a local business in a bathroom somewhere. But the ones that we can follow up, we've made 9 visits, very well received, the firefighters and the recovery coach. We've actually gotten 2 people to go to detox and allayed a lot of fears that the families had. I should also state that when I went down to D.C., the director of the National Drug Control Policy, Mr. Botticelli, came up to visit us, and we spoke. The mayor came over, and we had a meeting with him over at Boston Fire Headquarters. And again, he was extremely expressed. The quote was, "You people are light years ahead of the rest of the country." So we've been sending what we've been doing here in Revere down to D.C., so they're tracking us now to see how much further they can go to push this throughout the country. Massachusetts in itself is way ahead. But again, the numbers are way ahead. This year now, as the mayor gave you some numbers, I'll give you what I consider worse. We have already surpassed total of last year right now with overdoses. 157, I think, last year. We're beyond 160 now. It's not anything you're going to ever arrest away. The police chief up in Gloucester has this plan. We're both on the same radio program one night together. I disagree with a lot of things. It's very well intended, but there are some real holes in it. But it is getting help for certain people. We feel that this program is not just targeting the abuser, but the families as well. And I think that's one of the most critical things, is to get the help for families of these people. Because if the family doesn't understand what to do or where to get the help, it just isn't going to happen. The abuser really has to hit rock bottom before they'll make that realization. And most of the time, rock bottom is dead. And it's a very sad state of affairs. So we're going forward with this. We set up a website. We plagiarized quite a bit out of Weymouth, but they gave with permission, obviously. RevereRecoveryHelp.org. It's a great little website. It's in the process, but we've had quite a few hits on it already. We're pushing it out there. It gives a lot of links for people to get help, and because generally the abuser's not on the computer, looking that up. But once in a while they'll go out there. But if we get this information to the home, and we get it, the parents have it right at their fingertips, it'll make a drastic change. But it's an extremely difficult situation to be in. I go back with Mayor Ambrosino when we first started out, and now with Mayor Rizzo and his full push and support with it. Our fire union, it's been tremendous, the firefighters, but they see the difference in how this affects people. July 1st to this date, we've had 18 overdoses, 12 reversals or 13 reversals, and 2 fatalities. So it's, if we didn't have those reversals, it would be terrible. Everybody's, I hate to say, jumping on board, but because they have to. There is no class of people that become addicts. This crosses all socioeconomic boundaries. We're getting 15-year-old kids and 62-year-old women. I mean, it's utterly crazy how much this has affected society. The Commissioner of Boston told me that their Narcan reversals, or where they're applying Narcan the most, is in Boston's financial district. It's not in Mattapan, it's not in Dorchester, it's in the financial district. That means a couple of things. One, a little more affluent person that can purchase drugs. And it isn't just heroin, it's the Vicodins and the Perks and things such as that. But it's also the clubs and everything that's down in that area. But it has become the opiates have become a drug of a higher income. They say now that a great portion of people that are addicted to opiates exceed $50,000 a year in income. Now, before, that was all we would pen was the person that's on mass health, has no job, and, you know, is an addict, and is scum, and is this and that. It isn't. It's somebody's brother, it's sister, son, daughter, father, mother. It's across all boundaries. So, just as the mayor stated, we're there. We're trying to do the best we can, and we'll look for your support. Thank you.
Thank you, Chief, for that very informative presentation. And I'd also like to thank your department for the work that they do out there with regard to this administering the preventive for overdoses. Thank you, Mr. Mayor.
Just to bring up now Dimple Rana, who is our manager of our Healthy Community Initiative Department. So,
Dimple, please.
Good evening, City Councilors. So before I get started, I want to actually thank Chief Doherty and the Revere Fire Department and our Revere Police Department. And I believe Dr. Weil from our Board of Health was just here. We also have Joan Quinlan and Leslie Eldridge from the Center of Community Health Improvement of MGH. We also have Raquel Calderon here from the New England Region of Health and Human Services, Judy Lawler from the Chelsea Drug Court, Paul Kuziak from the he's Massachusetts Parent Ambassador for the Partnership of DrugFreeKids.org, and to all of our community members here also in the room. So tonight, as Mayor Rizzo had stated, we are here in collaboration with the City Council, Mayor Rizzo and his office, MGH Revere Cares Coalition, the Healthy Community Initiatives Department, and our Massachusetts Opiate Abuse Prevention Collaborative Grant, which funds our regional work of the ROC, the Winnisummit Regional Opiate Collaborative, again, which includes Revere, Winthrop, Chelsea, and Saugus. So tonight, we are here to present on Revere's responses to the opiate crisis. Our goals this evening include informing the City Council and community on what is currently being done and identify gaps as it relates to prevention, intervention, treatment, and recovery. Second, we want to leave you with recommendations on how we can move forward. I apologize that we do not have a PowerPoint presentation set up for our audience. We do have some packets that we will pass out, and then City Councilors, you also have the presentation in front of you. The information that we are presenting is current as possible. However, we may have missed something. And so we encourage everyone in the room to provide feedback on the note cards that we will pass out and leave it with one of the presenters before you leave. And we are happy to answer any questions after this presentation is over and take comments. And I'd also like to mention that Patrick Cronin of Moore has left some outreach material on the table to my left. Everyone is welcome to take a copy before they leave. At this time, I'd like to bring up Viviana Catano.
Thank you very much, Dimple. Could you please state your name and address for the council?
Hello, my name is Viviana Catano Merino. I am the manager of the Alcohol, Tobacco, and Other Drug Task Force for the Revere Cares Coalition, and I'm also a Revere resident. As the mayor and the chief already mentioned, I think we have an understanding of the immensity of the opioid epidemic, and I just briefly also wanted to share with folks some other facts that highlight the importance of taking action on what is happening. In Massachusetts alone, in 2013, there were 978 fatalities due to opioid overdoses. And speaking locally, from 2003 to 2013, Revere saw a 20% increase in opioid overdose deaths. That makes our city the 7th hardest hit in terms of fatal overdoses in all the Commonwealth. And the chief also illustrated that the use of Narcan has already surpassed last year's number. We understand that the opioid crisis is too big for one entity, department, organization to tackle on their own. Efforts have to be coordinated by multiple partners, and responding to the opioid crisis needs to be done in terms of the areas of prevention, intervention, treatment, and recovery. As you can see on page 3 of the presentation, there are many city entities, departments, and organizations already implementing some strategies. So I wanted to speak to those, and then we'll go more into detail about who is doing what. So in terms of the city of Revere, we have Mayor Dan Rizzo's office, the Healthy Community Initiatives, Fire, Police, Health Department, and Revere Public Schools. The Revere Cares Coalition has been around for 17 years, and through different grant sources, we have worked to prevent substance use disorders in our communities and to address the opioid crisis. The goal of our coalition is to do what we're doing right now, promote collaboration to improve the health of our citizens. Members of the coalition include residents, community organizations, elected officials, schools, police, fire, and health departments. What the coalition does cannot be done without all the people that sit at our table and make things happen. North Suffolk Mental Health and MGH have also been key providers in addressing this crisis. Last year, Massachusetts General Hospital established substance use disorders as an institutional priority. So now you can move on to page 5. So I wanted to give you an overview of what are the best practices in terms of prevention and what the city is doing in terms of those. So when you're preventing substance use disorders, whether it's for alcohol, tobacco, or drug, or as we're talking tonight specifically about opioids, you use similar strategies. First, provide information. This can be done via traditional media or social media, or it can be done in a setting such as tonight, where we're informing you and the community via television about this crisis and how we're responding. We also need to enhance the skills of those who can prevent substance abuse, meaning parents. What information and resources and skills do parents need to talk to their kids about preventing substance abuse? What information do teachers need? What do providers need? We also understand that our target audience in terms of prevention is teens who haven't started using. And these teens, they don't live in isolation. They're not in a vacuum. They need support to make positive decisions. So examples of providing support for teens include campaigns or alternative activities, positive alternative activities. We also understand that we need to reduce illegal access to prescription drug abuse or any other substance. We need to think about what is the physical design. How are youth accessing these prescription drugs? So one of the examples of these strategies is a medicine take-back event. If your assessment is telling you that nationally this is true, that the trend that most youth tend to get their prescription drugs from their own medicine cabinets at home. So you need to talk to parents and other people about safeguarding these medications. You also need to provide incentives for your partners. Again, nobody alone in this community can prevent substance abuse. All of us need to work together. So an example of an incentive, let's use the medicine take-back event again. Last year, we collaborated with Seaside Pharmacy to get the word out in the community about this event and the importance, and they helped to pass out flyers. So an incentive for them or anybody, a partner, the fire department, is to make sure that they receive proper recognition. And then finally is change in policies. And the target audience for these type of strategies is you, counselors, or to change laws or policies within the city. But this also applies to institutions. For example, a few years ago, Mass General Hospital changed their prescription practices in primary care in terms of prescription practices for pain management. So what is being done in our city in terms of prevention? From the city perspective, we have the mayor's office support every year. We collaborate, the coalition works with the mayor's office during Revere Shines to do the annual medicine take-back event where residents have an opportunity to properly dispose of medicine so they don't go into the wrong hands. As it was mentioned before, the Healthy Community Initiatives is the recipient and the fiscal agent for the Massachusetts Opioid Addiction Prevention Collaborative Grant. This is the regional grant that the mayor mentioned that includes Chelsea, Winthrop, and Saugus. And the prevention strategies that are currently being funded through this grant is another resource website where folks can access prevention materials, but also, once again, be connected to somebody who can help the loved one who is in trouble. We also have a community leadership strategy. So this is not only for our key leaders in Revere, but in the other cities as well, so that we may identify champions who will help and support and implement strategies. The Revere Cares Coalition does a couple of prevention strategies. Again, the Medicine Take Back event, which would not be possible without the support of the mayor's office, who helps us to advertise and get the word out. We also run the Above the Influence campaign. This is a national campaign that has been adopted for the city of Revere. It's a campaign to help young people recognize that there are positive and negative influences in their life and to encourage them to make positive decisions for themselves, especially around not using substances. Without the support of Revere Public Schools, we could not implement any of these campaign activities. September, you also have seen us come before you in September, which is nationally recognized as Recovery Month. During September, we organize a community walk for recovery. This is an opportunity where we usually gather over 300 Revere youth to come and show that they want to be above the influence, but we also bring folks in recovery to share their story so that community understand that there is hope, treatment does work, recovery is possible. For many years, our coalition has done an annual pledge drive where we visit all schools from the elementary to high school to ask parents to talk to their kids about not using substances and give them information and tips that they may need. We usually get around 800 parents for the past 10 years, to fill this pledge drive. We also do community education via traditional and social media. And the coalition had the Mass Call 2 grant to address opioids a few years ago. And one of the strategies that we implemented in collaboration with the fire department was the implementation of the permanent drop-off box, which is a resource that community members can use any time of the year to safely dispose of unwanted meds. In terms of providers, MGH Primary Care, North Suffolk Mental Health, and Cambridge Health Alliance also have their own prevention strategies. Now, I wanted to speak briefly to you about what are the intervention strategies. Intervention strategies are aimed at current users and saving lives. They include naloxone, which the fire chief already mentioned is a medicine that reverses the effects of an overdose. The prescription drug, the prescription monitoring program is aimed at doctors, pharmacists, and dentists, and this prevents doctor shopping and abuse of overprescription. Substance use disorder screenings at all schools and at all points in the medical system. And another important factor in terms of intervention is data transparency. We need to be sharing data among first responders and EMS so that we can identify what are the hot spots in our community so that we're able to send our community outreach workers there. Our current intervention strategies from the city are, as mentioned before, that the Revere Fire and Police Department have a grant from the Department of Public Health to carry Narcan. The city is the fiscal agent for the drop-in center, which has a community outreach worker. And as the fire chief mentioned, the fire department is doing outreach and education. The Revere Cares Coalition helps to funnel the determination of need funds that come from MGH. And in terms of providers, we have the MGH Pharmacy has a standing order for naloxone for all their patients. Chelsea Drug Court, North Suffolk Mental Health, the Parent Forum, Bay Cove Human Services, Bridge Over Troubled Waters, ROCA, and Learn to Cope are also implementing different intervention strategies. So now I would like to pass the presentation on to Julia Newhall, who will be speaking to you about treatment and recovery, best practices, and what's being done. And Sylvia Chang will close off the presentation. Thank you.
Thank you.
Good evening, thank you.
Name and address, please.
My name is Julia Newhall, and I am the Massachusetts Opioid Addiction Prevention Collaborative Grant Manager, which many people mentioned is the regional grant that oversees the City of Revere, City of Chelsea, towns of Saugus and Winthrop.
Thank you very much.
So I just want to start by thanking everybody for attending this event, and that we are in a bit of a crisis when it comes to the opioid epidemic issue. When we think about treatment, it's a very complex disease, and we try to look at it from like a multifaceted approach where there is no right way or wrong way. It really depends upon the individual. And so I'm going to go over some of the basics around what treatment is available, both on a broad level and at the local level. So if you'll look to page 5 of your presentation, acute treatment services and clinical stabilization services. This includes detoxes, so somebody who is trying to come off of the drug of their choice based on the physiological effects of that. We have step-down beds and services, so transitional support services, which when someone is in the interim from getting into long-term residential treatment, they go into a transitional support home. Recovery high schools, treatment and correction facilities, and medication-assisted treatment. That includes things like Suboxone, Vivitrol, and methadone. Some of the current treatment strategies within the local area include the drop-in center, which was mentioned tonight, every Tuesday evening from 5 to 8. That's overseen by the Determination of Needs Funds through the City of Revere. Revere Cares Coalition also helps fund the drop-in center. Providers include MGH, Revere Mental Health, and Social Services, and there's a Suboxone program within the health center. North Suffolk offers an array of services as well. Leahy Health Behavioral Services, Bay Cove Human Services, Community Substance Abuse Center in Chelsea, which is a methadone clinic, Habit Opco, Meridian House in East Boston, which is a therapeutic community, Easton Middlesex, which is in Malden, is a all-male residential halfway house, Casper, Hope House, Project Hope, Cushing House, and Gavin House. Those are adolescent programs in South Boston, East Boston Rehab, Ryan House, and Salvation Army and Spectrum, and East Boston Neighborhood Health Center. So these are just a few examples of local treatment providers, but you know, there are others as well, and it really depends upon the individual what type of treatment that they're going to seek out. If you'll go to the next page, like treatment, recovery is also a matter of the individual and what they think their journey towards recovery will be and should be based on their own needs. When we think about recovery, the two terms often get convoluted, treatment and recovery. And so the biggest emphasis on recovery is more about the stigma related to it, and to recognize that the recovery population should have a voice and a face, and does have a voice and a face, and we need to be cautious of that and make sure that they are at the table, and that this is something that we want to make sure their voice is being heard throughout this conversation as they've already experienced it within their own lives. Also, medication-assisted treatment are examples. Support services include reentry programs for people who have been recently released from prison or jail, and things like employment services, removing barriers around the quarry, reducing stigma, expanding peer and support services. On the local level, as far as the recovery services are concerned, like I said, we have the drop-in center every Tuesday evening. Our peer recovery coach in Revere couldn't be here tonight, but through the Mass Call 2 grant, she was funded and is now actually the lead recovery coach for the 4 recovery coaches that we've hired through the MOAPC grant in Winthrop and in Saugus. And so we're actually trying to build the infrastructure within these communities to hire these peer recovery coaches, which have become a promising practice. And really the goal is to pair people up who have been through similar experiences and help them find mentors so that they can go through their journey of recovery and become acclimated into the community as well. We have the Revere Cares Coalition, which every September does the Revere Beach Memorial to recognize those who have lost their lives to addiction, but also try to decrease the stigma that is attached to it. And we have MGH, Revere Mental Health and Social Services, in recovery coaches, MGH has hired, I believe, 5 recovery coaches throughout their local health centers, and so that's something that obviously is becoming a trend across the recovery community. And MORE, which is the Massachusetts Addiction Recovery, and as I believe Dimple mentioned, there are some booklets over there on the table. It's a very comprehensive guidebook that I recommend people take with them, and I thank Patrick Cronin for coming here tonight and bringing those resources. And also want to just thank the mayor for agreeing to support an opioid task force, and I look forward to collaborating with all of you in the future and really try to focus on this issue because this is a matter of life and death. So thank you very much. And Sylvia Chang will come up.
For the record, would you state your name and address, please?
Sylvia Chan,
Just
the new director of Revere
Okay.
Cares.
welcome.
I will continue the presentation outlining for you the gaps that we identified at this moment, but we are open to hearing if the other stakeholders have identified even more. Unfortunately, we have gaps in all 4 areas that we need to address of prevention, intervention, treatment, and recovery. And then I will go through the recommendations that we have for the council. In terms of the gaps for prevention, we definitely need more information. The type of information needed is varied. One is demographic information, mainly of the high-risk population. We also need more information on what the current resident knowledge, perceptions, and norms are in the community. And then the current risk and protective factors that need to be improved in this community. We also want to enhance the education opportunities, a lot of it some of it at the school level, maybe increase the time of education and use a curriculum, implement a full curriculum for education at that level. And we would also like to increase parent education and opportunities for skill building of parents at the prevention level. Again, in prevention, we want to increase activities for enhancing the community awareness around this problem. And we also need to build capacity at different levels. The capacity needs to be built in terms of adequate staffing and financial resources in all our organizations that are currently working on the problem. We want to increase participation from all sectors. We also need to improve the evaluation processes. Again, we need to fill in data gaps. We need to increase partnership agreements. And within our participating organizations, we need to make a better job of outlining in job descriptions the specific tasks of working around this issue for some positions in partnership organizations. We want to make a better analysis of the stakeholders and make an accountability map. And we also want a stronger collaboration with the justice system. In terms of intervention, the gaps that we identified were we need to increase patient education around the risk of prescription drug addiction. We would also like to increase the use of prescription monitoring program and increase the capacity of the drop-in center. The professional development and educational training for those already addressing substance use disorders also needs to increase. And we need to increase efforts to address the stigma at family, community, and institutional levels. We also would like to enhance the ability to share data between all first responders to opioid overdose calls. And in the treatment area, again, is increasing. But we need to increase the knowledge and transmit this knowledge of insurance coverage, which is very confusing and families lack. We also need to increase adequate screening, the treatment, and increase support services. That's at the treatment level. In terms of recovery, the gaps that we have are that we still have big barriers to social mobility, such as employment for people in recovery. We need to increase these recovery-oriented services. Apply evidence-based approach to sentences, increase support for the families, educational training across institutions, and again, increase trainings and efforts in the recovery area or to address stigma. So as you can see, there's still a lot of work to be done. And at this point in time, you probably then have some logical questions in terms of, okay, so which gaps can we address? It is very clear that at the local level, we cannot address all these gaps. And so it will be a matter of understanding these gaps and identifying which ones need to be addressed more at regional or even state or federal level. But of those gaps that we identify that can be addressed at the local level, we now then need to prioritize because they are many, and we need to understand which ones are the critical ones to address. So let's pause at this point, and we will agree to acknowledge that we've at least accomplished the goal of informing you, the community, and the City Council on what are the best practices and what are the current things being done locally and some of the gaps we've identified. But I think we all agree that this is a lot of information in a short time, and we need to be more comprehensive in addressing it. So we would like to proceed to make a recommendation. We know that in a previous City Council meeting, it was proposed the formation of a local opioid task force, and it was sent to Public Safety Committee. So our recommendation is the following. In the public health field, we are going around using the term collective impact. And all it means, and all it is a more structured approach to a collaboration effort in order to make sure that we will achieve significant and lasting social change. This is a complex problem, and as we've said before, not one institution can address it, but the collaboration of many at different levels. So this collective impact framework calls for a backbone organization. And this is similar to the role Revere Cares has had in the past, but I will explain to you, according to this framework, what the backbone organization needs. It needs to have some funding, and it will need to have staff with the following skills. It is a staff that knows how to lead and convene, direct, facilitate meetings, and in terms of facilitation, among other things, is moving from consensus to action. It needs to have the capacity to analyze data, to monitor policy changes and analyze them, to coordinate and administrate meetings and schedules and things like that, and manage communication efforts and maintain relationship with funders. Through those skills and in that capacity, the backbone organization is able to guide a vision that these different stakeholders need to agree upon, develop a strategy, and it will be able to support aligned activities, establish shared measurement practices, build public will, advance policy, and mobilize funding. So the next step is we recommend that the Committee of Public Safety move on to identify a backbone organization that can immediately work together with those stakeholders that are ready to come together at a table and pick up from here. Look again, the gaps, make sure that they're complete, analyze and understand them, prioritize, and proceed to make a plan to implement new strategies. You also, in your packet, have a third handout that has the list of recommended stakeholders that DPH has identified are important for this table. You also have the list of the current participants for the regional effort. These members vary in the level of engagement currently, but they were called originally to participate at the regional level. And you also have the regional people at the names of the regional effort, of the regional partners for that effort. So we as Revere Cares, we're here to help, continue meeting, offer any collaboration that's needed. And we truly believe that, as been seen in the past Revere history, together we can make a difference. So thank you.
Thank you. Now, are there any councilors that have any questions? Well, Councilor Zambudo?
No, I just want to thank everybody for the presentation, but what I will say is that the information that was provided tonight will be very helpful for people that are trying to reach out to people that need recovery. The fire department, I want to congratulate the chief and his people for great resources here, and the Revere Cares and everybody involved for all this information. It's a lot of information, but those of us that refer people that are looking for help know how valuable this information is. So I want to thank you very much.
Thank you, Councilor Zambudo. Councilor Redden.
I just want to say from my experience in my law practice that everything the chief said is true, particularly about the fact that this is a problem that overrides virtually every social, economic, and cultural spectrum of our citizenry. It really is astoundingly non-exclusive, this addiction, and we really need to work much harder to not only identify potential people who have potential to succumb to this, but effective treatment programs to deal with it once we identify them. And it's really, you know, from my perspective, unfortunately, the treatment programs seem to be all over the place, and I think most people in public health will agree that, you know, you'll get a better program here or a worse program there or something like that. But really, we need to do a much better job of finding consistently effective programs to deal with people who suffer, so we don't have multiple situations where Narcan is used. And I see this all the time, where I'm seeing more and more people who are not only treated once with Narcan, while it's hard to believe, sometimes 3 and 4 times. And that tells you an awful lot about how serious this problem really is. And so I congratulate you people for working so hard on that. And I know I speak for my colleagues when I say that we'll do anything and everything we can to join in this effort. Thank you very much.
Thank you, Councilor Reardon. Any other councilors? Councilor Morabito.
Thank you, Mr. President. I just want to praise the efforts of the health department, the fire, the police department, all the other volunteer groups and non-volunteer groups who put their all into this to make this for keeping this issue in the public eye. And I think it's very important. And I think this event is the launch pad of letting people know that there are resources out there and they're not alone. And it takes many people and many parts working together to get through this and to create awareness. And I think this is a great positive step. And thank you for your presentation.
Thank you, Councilor Morabito. Are there any members of the police department that are here that would like to elaborate on this issue? Lieutenant Goodwin?
Just before Lieutenant Goodwin comes up, I just want to follow up on what Chief Doherty said. And this is a problem that crosses all ethnic groups, religious groups, socioeconomic groups. It is a major problem, and I just want to say that all of the speakers that you heard from earlier work every day in addressing this problem. We do have a very, very talented group of people here that are aggressively working to help I'll say solve the problem. I don't know right now how I personally feel, how solvable it is, but how to mitigate the problem to the extent possible through all these efforts with respect to prevention, education, treatment. These are all very, very important aspects. And we have a terrific team. Obviously, you heard those that spoke here tonight, but also our police and fire department that are leaders really across the country in what they do. So with that, Lieutenant Goodwin.
Thank you, Mr. Mayor. Lieutenant?
I've been doing this for 22 years, and I just want to say that I
Is that Michael?
support treatment. Good?
Go ahead.
Good. I support the treatment as much as anybody else, and, there isn't a week goes by that we don't call one of our colleagues from the service providers for assistance with someone who has an addiction, whether we're trying to help someone get a bed, get someone detoxed. But I also want to remind the people that what we do is we put drug dealers in jail. That's what we do. And there's a big argument in the state about minimum mandatory jail sentences for drug traffickers. I'm not talking about people that have addictions. And I just want to remind everybody, because they are making a move to reduce those minimum mandatory sentences, again, for drug traffickers. They've raised the trafficking weights in the last couple of years, which prevents us from charging unless we, arrest someone with a significant amount of drugs. And the minimum is 18 grams. And anybody with 18 grams of heroin doesn't have an addiction. And if they do, they're also trafficking in heroin. And I just want, particularly our elected officials, to know, and this has to resonate up to the State House, that if we lose the minimum mandatories, it's really going to make it that much more difficult for us on this, because I believe that that is equally as important as the treatment and the prevention programs, which I support wholeheartedly. But again, for second subsequent offenses, for distribution of narcotics and trafficking, that's important too. And we need your help, the City Council, to let our state delegation know that we need those to protect these communities. That's it. Thank you.
Thank you, Lieutenant Goodwin. Anyone else?
Hi, good evening. Amy O'Hara, 400 Revere Beach Parkway. I just want to mention that the Revere Police Department recognizes that we can't arrest our way out of this problem. This is something we knew previous to Chief Caffarelli's administration with Chief Reardon. He was a chartered member of the ATOD task force. He was there when Chief Doherty and Captain Piccarello talked about Narcan, became educated about it, and realized a little bit more about addiction than he probably didn't know before. He was also in the forefront by having a drug drop-off box at the Revere Police Station, something that other departments didn't have at the time, but we have it all the time. We just don't have one event. So when Chief Caffarelli took over in office, he wanted to make sure that we continue to be involved in the ATOD task force and continue to be part of a problem-solving approach. The Revere Police Department is also involved with 2 grants. One is with the Revere Fire Department, which is the first responder grant. As we know, the Fire Department was one of the first agencies in the country to carry Narcan. The Police Department, hopefully in the future, will be carrying it as well. We are currently trained in the use of Narcan. We have to overcome a couple of hurdles to be able to carry Narcan. When you have a police department and a fire department and other agencies that we're all collaborating on, we're in the forefront. You don't really see that with other agencies, but we've already been there. We're also involved, again, with the ROC. It's a regional grant that the Revere Police Department sits in on, and we're there when the fire department talks about the toolkit that they use when they have an overdose. We're there helping them decide different strategies we can use to address this issue. See, the police department, we're with Cataldo and the Revere Fire Department when we respond to medical aid calls and overdoses. And one of the things we've done is we changed the way we document these issues, and if there's a fatality, we make sure it's documented in our computer system, something something we didn't do before. So the police department, I just want to say, is involved, and we're here collaborating with the other agencies, trying to come up with problem-solving approaches in trying to deal with this other than enforcement, which we know is a piece of the puzzle, but we're also looking at other strategies.
Thank you, Lieutenant. Councilor Patch.
Thank you, Mr. President. I just wanted to make the people aware that I had a conversation with Chief Caffarelli today, and I want to thank him for, he couldn't make it here tonight, but I want to thank him for sending Lieutenant O'Hara and Lieutenant Goodwin. They both are very capable in what they do, and again, I want to thank them, and also along with the chief of the fire department, Chief Doherty, who, him and his men, I mean, they're unique. They started the whole thing, and he should be thanked immensely for it. Thank you, Mr. President.
Is there anyone else out there that would like to speak on this issue? Okay, hearing none, I just, sir, please come up to the microphone, state your name and address.
Good evening. My name is Jerry Cole, C-O-L-E. I work out of Chelsea Juvenile Court, which is part of Suffolk Juvenile Court probation officer. I cover Winthrop and Revere. I see firsthand a lot of the younger onset issues with the juveniles. And for many people that in this room may know, juveniles now are up to 18 because there was a law change. Grew up in Medford, very familiar with Revere, and the political structure and the infrastructure in different cities. One thing is I've been a member of the Revere Cares Task Force for a number of years also, and I would suggest that this community has a lot of infrastructure, a lot of talented people, a lot of caring people. I come across them in the school departments, out in the streets, on the corners, the police that I know. We work hand in hand. Court system's there for the community, of course. But the court system sometimes is sort of that last resort. Adults is a bit different. What I would want to bring to your attention also about Revere Cares is that they're respected nationally because I've been involved with 5 or 6 other coalitions that were startup coalitions, and they look to Revere Cares for assistance and guidance at the beginning, so they do fantastic work. What I see lacking in Revere, in some cities too, is I've never seen a youth center. I know there's the youth zone, but I'm talking about a youth center. Salesians, East Boston, the YMCAs, the Boys and Girls Clubs. So one thing I would suggest is vacant buildings, space, land, business partnerships is something out there. Schools at night, mixed-use communities. A lot of these schools are made in a way where you can actually use the school externally from the street, the gym, the caf, certain areas, and not be in the halls and the classrooms, which everyone's familiar with how the new schools are built. So I would strongly suggest that that ends up as a agenda item on both ends, City Council and also School Committee. The other thing that I think would be really important, and I see this with the changes in the marijuana law, is that if you have a solid policy internally in the city on how you deal with marijuana issues, and not just the citation part of it, but for instance, every youth caught in school with marijuana, it's not an arrest, it's not a court issue anymore, we don't see them. So if there's mandatory 12-week program, 1-hour class for 12, again, it's within the statute, but there's mandatory and certain things that happen consistently all the time, those are interventions that are very, very important. And if those interventions happen, you deal with these type of issues on the onset end early on in the schools. Make no doubt about it, there are 12, 13-year-old adolescents out there exposed to the opiate issue. They see it in their families. They may have experimented. I tell this story sometimes to people, and I think it's an eye-opening experience. I sat with 3 or 4 kids one time in my office, and they were talking. They were only about 15, 16 years old. And I was talking about, they talked about a party they went to, and they said they went to a Skittles party. And I said, Skittles? I go, you got to help me out with this one. So the party was, you get your prescription drugs, You get them out of the house, you get them out of grandmom's, you get everywhere. You go in, you take a bowl, a fish bowl, you throw them in the fish bowl. People pay, go through the door, you get a scoop, you get a handful, whatever. Were they exaggerating? Possibly. But just within that context, if there is that fish bowl, no one really knows what's in that. So to aggressively look at how the marijuana issue is treated, and I know there's limitations, that goes a long way. The last thing I would suggest to the mayor and his office and others, and it may exist, is a committee, exploratory youth committee. And look at youth center issues, look at youth issues, get a cross-section across the city. I'd be more than willing to be part of that. But these are just some things from my end. We're very concerned on the juvenile court side because we see a different escalation now because we're missing the younger kids on the first time pot possession or the lower end offenses, and we're seeing them a little bit older along, more hardened, more experimental with the drugs, a lot of prescription meds. So it's very concerning. So just those several suggestions are some things that I think would really help in the community. I know it takes time. I know it takes funding. I know it can't happen overnight. But those are just 3 areas that I think really are important on the adolescent youth side.
Thank you very much, sir, for your input. Councilor Rigo, you wanted to speak?
Thank you, Mr. President. I'll be brief. I just want to thank the presenters tonight for their hard work. They really are tackling this issue. I think we have a lot of confidence in the fact that we have good people helping to tackle this issue. And obviously the comprehensive presentation that was put forth tonight speaks volumes to what the work that's being done every day. To the previous speaker's point, I can't agree more, and I do want to mention that we actually have Councilor Giannino and I have a motion tonight about a group called Revere Youth in Action that has done a lot of work in the build-up to trying to think about and trying to frame the debate on building a youth center in Revere. It is much needed, and I want to remind people that we do have a high school to build in a couple of years, and a youth center as part of that high school would probably make sense in terms of a package of building construction. But again, I want to say that Councilor Giannino and I put this motion in a couple of months ago to raise awareness and to start the dialogue. I think this is a great beginning to that. I don't want to see it end, and I know we're going to continue to be active partners with Revere Cares and with the city to make sure that we do address this issue. And again, I can't commend the presenters enough tonight, and I look forward to working with everyone. Thank you.
Thank you, Councilor Rigo. Councilor Giannino?
Thank you, Mr. President, and I'll be brief. My colleague stated most of my points, but the most important one is we put that motion in originally to create a conversation, and I think that's exactly what happened. It started with a very small conversation with Viviana and Kitty and Brian and I, and it's expanded to the entire community, and you have 3 police lieutenants here. You have the fire chief and members of the fire department. You have members from all different areas in our community that are here to help, and they're not just here for tonight. They're here for the community 24 hours a day, 7 days a week. So this isn't just a conversation that we're going to start, we're going to talk about it, it's done, move on. This is something that is present in our community. It's something that's not going away anytime soon, and it's something that we're looking at and we're going to have a solution to eventually. And I want to thank everybody here. I know Councilor Rigo mentioned the students from Revere Youth in Action. That does come up later on the agenda this evening. There was a clerical issue. It was submitted on the 26th, but there's a late communication. But we do have members of our community that are students that are just as involved as the adults that are in this room. So I'm really happy to see that, and I think that there's going to be a bright future for Revere. That it's always really bad before it gets really good. Thank you.
Thank you, Councilor Giannino. I want to thank, first of all, Revere Cares for the presentation being made here this evening, taking your time to come up here and express your concerns for the youth of this city. I also want to thank the Chief of Police for sending his officers up here this evening, and I know how hard they work. I've seen them in action out there, and it's a very, very large problem, and it's a problem that I think has to be addressed more nationally than as well as locally. There are too many individuals in this city and around the country, I would imagine, that would go to a doctor and say, I have a sore back or I have a sore arm, and the doctor writes a script for them. And then an hour later, they go to another doctor and same presentation, and the doctor writes a script for, again. And before you know it, they have 2 or 3 scripts. They're selling them on the streets. They're getting into more aggressive drugs. I think that there needs to be a system in this state and in this country that's computerized, where you go for a prescription, I don't care who you are, you have to have some type of an ID with your picture, your date of birth, your social security number. It's put into a database where that doctor can turn around and say, hey, you're in Everett now, but you were in Revere yesterday and you got a prescription from Dr. X or whoever it might be. And this is, I think, one of the ways to solve the problem in this country, to make sure that these prescriptions are not as available to people that use drugs. I think another thing is that in your home, if you see your son walking around or your daughter with a bottle of prescription drugs, question them, find out where it came from, find out why they have it. If they said they got it from a doctor, call the doctor if they're underage and find out why that doctor issued that prescription. These are all things. In addition to what you people do here, you do a great job. I've watched you over the past 15 years, Kitty. I've seen how your organization down there operates, and you've done so much to stop and prevent addiction in this city. And I want to thank you on behalf of the City Council and the City of Revere this evening. And I want to thank the mayor for your input, and also Chief Doherty. His firefighters are out there constantly answering medical calls for addiction overdoses, and they do a tremendous job, and thank God we have them. Thank you.